Jaundice is a pretty much common thing in most babies after they're born, basically because of two important reasons. When they're in the mother's womb, they have a very high hemoglobin because their lungs are not working and they're getting the oxygen across from the placenta. Once they're born, their lungs start working and they don't need to get this oxygen across from the placenta. They can do it directly from the baby's lungs. So they have a very high hemoglobin when they're inside the mother's womb, and once they're born, they don't need to have such a high hemoglobin. So they tend to start destroying this hemoglobin, and the pigment within the hemoglobin is known as the bilirubin. So that gets released into the blood a lot more. So most babies do tend to get jaundice at that time. The other reason is this jaundice needs to be removed from the baby's liver, and the baby's liver is usually not functioning back to full capacity immediately after they're born. It takes a few days after they're born for the liver to start working perfectly fine. A combination of these two factors, one is increased production of the jaundice pigment, which is the bilirubin, and the fact that the liver is not working at 100% capacity makes the baby a bit more jaundiced. This jaundice is totally different to the jaundice you see in adults. It is not because of an infection. It is known as physiological jaundice. It's not because there is an illness in the baby. It's a very normal thing that happens in most babies. Most of the babies may not need treatment. A small proportion of the babies will need treatment for the jaundice. And as parents, the most important thing is that you need to be aware how to look for the jaundice. Again, a common belief is that babies are born with jaundice. That happens in a very, very, very small percentage of babies. Most babies start developing jaundice only after 24 or 48 hours after they're born. So it's not that they're actually born with jaundice.